Hello, my name is Debbie Gilbert. I am in the RN to BSN program, and my capstone project that I am doing is in regards to prevention and reduction of CLABSI. I graduated in 2004 with an associate's degree in nursing. I spent my first year as a nurse on a cardiothoracic unit. I spent 8 years as a hospice nurse, and for the last 4 years, I've worked on an LTAC unit, primarily weaning patients from ventilators. Where my practicum was done and my capstone was focused on was on an LTAC unit called the Continuing Care Hospital. I weaned patients from ventilators there, but I did my practicum there, and the patients there often have central venous catheters, and they receive IV antibiotics very frequently for a certain amount of time, certain course, a longer term. So they come to an LTAC unit to receive that and to wean from ventilator vents also. So the capstone that I focused on for my capstone project, it focuses on prevention and reduction of central line associated blood infections, or CLABSIs. CLABSI is defined as a disease that results from the entry of a disease-causing germ or germs through central lines in the bloodstream, and primarily is due to the contamination of the central lines. That's used in fluid and medication transfusion for critically ill patients. I chose to do my capstone project on the prevention and the reduction of CLABSIs because the primary group of patients is made that I care for that have central venous catheters, and our unit on the LTAC, the Continuing Care Hospital, has made great strides in the prevention and reduction of CLABSIs. The primary focus regarding CLABSI prevention and reduction within this capstone project is to look at the evidence-based practices that focuses on quality and safety education for nurses' competencies of safety and quality improvement. According to the Center for Disease Control and Prevention, central line associated bloodstream infections, or CLABSIs, are responsible for thousands of deaths annually and corresponds to billions of dollars that's spent by the United States healthcare system. The Continuing Care Hospital, where I did my practicum, they wanted to improve upon a CLABSI prevention and reduction program, and so they did a pilot for a year where the use of alcohol impregnated caps would be used to place on the hubs of central lines when they're not in use. So, what's the significance of this? Evidence-based studies and information about the prevention and the reduction methods for CLABSIs are essential for eliciting proper measures and practice that every healthcare worker involved with caring for a vascular access device should observe. Another significance would be the information regarding prevention and reduction of CLABSIs. It outlines improvement ways of managing healthcare and economic expenditure on CLABSI treatment versus prevention practices. So during my practicum, I was able to discuss with the infection control nurse there regarding the CLABSI prevention policies and their protocols. So she and we discussed 2 specific case studies, and they revealed that the events that led up to the patients acquiring CLABSIs while they were on the LTAC unit, and the questions, it questions ways that the CLABSI could have been prevented. Those case studies did. So they looked at those, and they specifically were looking at what the nurses were documenting and the handling of the central venous catheters by the nurses. So the stakeholders involved in caring for the central venous catheters they were looking at. So I reviewed literature while researching CLABSI prevention and reduction. I was able to review numerous amounts of evidence-based literature for this project. There's a lot of information out there, a lot of good studies being done. But specifically, to write and discuss this project, I did literature review for 11 different references, for which are listed within my references for my capstone paper. Okay, so what I reviewed during this literature was CLABSI pathogenesis, which was understanding the pathogenesis of CLABSI. It is a prerequisite for discussing the prevention and reduction of CLABSI. I looked at the microbiology of CLABSI. That means understanding and recognizing the organisms that were associated and responsible for CLABSIs. And then I looked at prevention and reduction of CLABSIs, looking at the risks at various points, including the insertion of the central venous catheters, the maintenance of central venous catheters, and the removal of central venous catheters. Also, the importance of investing, I looked at the importance of investing a well-maintained infection control program, for the surveillance of CLABSI prevention and reduction, such as what the continuing care hospital did with the alcohol-impregnated hubs, caps for the hubs. Looking at I also looked at the basic prevention practices, such as pre-insertion, insertion, post-insertion, and central line bundles, hand hygiene, chlorhexidine use, the selection of the catheter sites, and the daily assessments of the necessity of the central line. Do they still need it? Are they off the antibiotics? What's going on with that? Are we talking to the doctors about getting those lines out if they're not necessary? Because the longer they're in, the more at risk the patients are for a CLABSI. So, what was learned through this capstone project? Well, CLABSIs, they cause significant morbidity and deaths like other healthcare associated infections, but the infection is preventable with the adoption of evidence-based practices and specific guidelines and protocols and policies. Education of the staff is key. Ongoing education of the staff is key to prevent CLABSIs, and setting up good policies and procedures is key to help with prevention and reduction of CLABSIs. And finally, nurses, on a final note, they are the key and the important role to play in the reduction and prevention of a CLABSI. Good assessment skills, monitoring what's going in and how we're maintaining and handling those central venous catheters during our shift, during the patient's stay, in order to prevent complications. So the overall project was a good experience, a more eye-opening experience, and it just reveals how important that we as nurses can step up and monitor central venous catheters and handle those appropriately. Don't draw blood from those if not necessary. You have to have an order, obviously. But every time we access those, we are putting the patients at risk, and make sure that we're maintaining and following protocol. So it was a good project, and I learned a lot. Thank you.